World Blood Donor Day takes place on 14th June every year. The aim is to raise global awareness of the need for safe blood and blood products for transfusion and of the critical contribution voluntary, unpaid blood donors make to national health systems. The day also provides an opportunity to call to action to governments and national health authorities to provide adequate resources and put into place systems and infrastructures to increase the collection of blood from voluntary, non-remunerated blood donors. Throughout the COVID-19 pandemic, despite limited mobility and other challenges, blood donors in many countries have continued to donate blood and plasma to patients who need transfusion. This extraordinary effort during a time of unprecedented crisis highlights the crucial role of well-organized, committed voluntary, non-remunerated blood donors in ensuring a safe and sufficient blood supply during normal and emergency times. Donate your blood for a reason. Let the reason to be life.
For 2001, the World Blood Donor Day theme is Give Blood and Keep the World Beating. The message highlights the essential contribution blood donors make to keeping the world pulsating by saving lives and improving others' health. It reinforces the global call for more people all over the world to donate blood regularly and contribute to better health. A special focus of this year campaign will be the role of young people in ensuring a safe blood supply. In many countries, young people have been at forefront of activities and initiatives aimed at achieving safe blood supplies through voluntary, non-remunerated blood donations. Young people form a large sector of population in many societies and are generally full of idealism, enthusiasm, and creativity. The specific objectives of this year's campaign are to thank blood donors in the world and create wider public awareness of the need for regular, unpaid blood donation. Promote the community values of blood donation in enhancing community solidarity and social cohesion. Encourage youth to embrace the humanitarian call to donate blood and inspire others to do the same. Celebrate the potential of youth as partners in promoting health. Host of World Blood Donor Day 2001 events. Italy will host the World Blood Donor Day 2001 through its National Blood Center. The global event will be held in Rome on 14th June 2001.
The only source of blood for patients who need a transfusion is a generous blood donor. Blood cannot be made or manufactured outside the body. Obviously, blood is necessary for life. It delivers oxygen and nutrients throughout the body, as well as carrying waste products away from cells. A single pint of blood, which is about how much a donor gives, can help more than one patient needing a blood donation. Health benefits of donating blood include good health and reduced risk of cancer and hemochromatosis. It helps in reducing the risk of damage to liver and pancreas. Donating blood may help in improving cardiovascular health and reducing obesity. Today, most medical care depends on a steady supply of blood from donors, as 1 in 7 people entering the hospital need blood. An adequate amount of blood is needed in all healthcare facilities to meet the urgent need for patients facing trauma and other life-saving procedures such as blood transfusion. This saves millions of lives each year. Donating blood is a simple procedure that can be done within an hour. A single donation can save 3 lives. One blood donation provides different blood components that can help up to 3 different people. Donating blood can help in treating patients suffering from cancer, bleeding disorders, chronic anemia associated with the cancer, sickle cell anemia, and other hereditary blood abnormalities. It is important to know that human blood cannot be manufactured. People are the only source of it, and that is why it is important to donate blood and help those who need it. It is also possible to store your own blood for your future needs.
Donating blood is a simple thing to do, but it can make a big difference in the lives of others. First step of blood donation is to fill out a donor registration form which includes your personal information and health information. Then a community blood center staff will perform a short health exam. It involves taking your vital signs and a finger prick test. Now you are ready to donate. If all your screening meets requirements, you will be directed to a donor bed. A phlebotomist will clean your arm with an antiseptic and use a blood donation kit to draw blood from a vein in your arm. You will donate 1 unit of blood. After removing the needle, the phlebotomist will have elevate your donation arm and apply slight pressure to avoid clotting. When you are ready, you come back to the donor cafe. Let the volunteer bring you a drink and snack. It's a good idea to relax for 10 minutes and replenish until you feel strong enough to leave. The entire process will take place less than 1 hour. There are several parameters that determine the eligibility of an individual to donate blood. The donor must be fit and healthy and should not be suffering from any transmittable diseases. The donor must be 18 to 65 years old and should weigh a maximum of 50 kg. Pulse rate should be between 50 and 100 without any irregularities. Hemoglobin level should be a minimum of 12.5 gram per deciliters. The time period between successive blood donations should be more than 3 months. A person who has consumed alcohol in past 24 hours are restricted. Women who are pregnant or breastfeeding are restricted from donating blood.
There are certain conditions that prevent a person from donating blood temporarily or permanently. Among the temporary conditions are pregnancy, acute fever, recent alcoholic intake, tattooing, surgery. Persons with the following conditions are not allowed to donate blood anytime. The conditions are cancer, cardiac disease, severe lung disease, hepatitis B and C, HIV infection, AIDS or sexually transmitted disease, unexplained weight loss of more than 5 kg over 6 months, chronic alcoholism, other conditions or disease stated in the Guide to Medical Assessment of Blood Donors.
There is no end to the benefits of donating blood. Blood donation not only makes the receiver's life good, but also helps the donor to maintain good health. The health benefits of donating blood. First one is prevents hemochromatosis. Hemochromatosis is a health condition that arises due to excess absorption of iron by the body. Regular blood donation may help in reducing iron overload. Next, anti-cancer benefits. Blood donation helps in lowering the risk of cancer. By donating blood, the iron stores in the body are maintained at a healthy level. A reduction in the iron level in the body is linked with low cancer risk. Next is maintains healthy heart and liver. Blood donation is beneficial in reducing the risk of heart and liver ailments caused by the iron overload in the body. Next, weight loss. Regular blood donation reduces the weight of the donor. This is helpful to those who are obese and are at higher risk of cardiovascular diseases and other health disorders. Next is stimulates blood cell production. After donating blood, the blood body works to replenish the blood loss. This stimulates the production of new blood cells and in turn helps in maintaining good health. The health benefits of donating blood are considerable, but of course, the most important part of the process is helping to save lives.
Every year, countries around the world celebrate World Blood Donors Day on 14th of June. The event serves to raise awareness of the need for safe blood and blood products and to thank voluntary and paid blood donors for their life-saving gift of blood. A blood service that gives patients access to safe blood and blood products in sufficient quantity is a key component of an effective healthcare system. The global theme of World Blood Donors Day 2021 is Give Blood and Keep the World Beating. The message highlights the essential contribution that the blood donors make to keep the world pulsating by saving lives and improving others' health. Italy will host World Blood Donors Day 2021 through its national blood centers. Your involvement and support will help to ensure greater impact for World Blood Donors Day 2021 and increasing recognition worldwide that giving blood is a life-saving act of solidarity and that services providing safe blood and blood products are an essential element of every healthcare system. Participation of interested partners is welcomed at all levels to make World Blood Donors Day 2021 a global success. Thank you.